Hey everyone, Dr. Liza here, and welcome back to my channel. As healthcare professionals, we know that providing high-quality care is paramount, especially when it comes to the incredible journey of pregnancy and childbirth. That's why today, we're diving deep into the world of standard midwifery service standards. These standards, based on the latest scientific evidence and best practices, serve as a roadmap for midwives and other healthcare providers to ensure the best possible outcomes for mothers and babies. We'll be covering a wide range of topics, from prenatal care to postpartum management and emergency situations. Whether you're a seasoned midwife or a student just starting, this video will serve as an invaluable resource for understanding the key elements of quality midwifery care. So grab your notebooks, get comfortable, and let's get started. First and foremost, let's talk about the foundation of quality care: general service standards. These standards encompass the core principles that should guide every interaction and decision-making process in midwifery practice. We're talking about informed consent, respecting patient autonomy, maintaining confidentiality, and ensuring cultural sensitivity. It's about treating every individual with dignity and compassion while providing evidence-based care that's tailored to their unique needs.
This standard emphasizes the importance of a holistic approach to midwifery care. It's not just about pregnancy and childbirth, it's about empowering families to make informed decisions about their reproductive health. This includes providing education and counseling on family planning, preconception care, and healthy lifestyle choices. It's about equipping families with the knowledge and resources they need to thrive before, during, and after pregnancy.
Accurate and comprehensive documentation is crucial in healthcare, and midwifery is no exception. This standard highlights the importance of maintaining thorough medical records for every patient. We're talking about documenting antenatal visits, labor progress, medications administered, and any complications that arise. This not only ensures continuity of care, but also serves as a vital tool for communication among healthcare providers and for quality improvement initiatives. Now, let's dive into the specifics of antenatal care, which is essential for monitoring the health of both mother and baby throughout pregnancy. These standards cover everything from routine checkups and screenings to managing common pregnancy complications. We'll discuss the importance of monitoring fetal growth, assessing maternal well-being, and providing education on nutrition, exercise, and childbirth preparation.
Early identification of pregnancy is paramount for ensuring timely access to prenatal care. This standard emphasizes the importance of raising awareness about the early signs and symptoms of pregnancy. It encourages midwives to actively engage with women in their communities, provide education on pregnancy tests, and establish clear referral pathways for confirming pregnancy and initiating care.
Regular antenatal checkups are the cornerstone of prenatal care. This standard outlines the essential components of these visits, including monitoring blood pressure, weight gain, fetal heart rate, and the mother's overall health. It also emphasizes the importance of individualized care plans, addressing any concerns or risk factors that may arise during pregnancy. This standard focuses on the skill of abdominal palpation, a fundamental technique used by midwives to assess fetal growth, position, and well-being. It highlights the importance of proper technique, accurate interpretation of findings, and understanding the significance of any deviations from the norm.
Anemia is a common complication during pregnancy, and this standard addresses its effective management. It covers topics such as iron supplementation, dietary recommendations, and the importance of monitoring hemoglobin levels throughout pregnancy to prevent complications for both mother and baby.
Hypertension or high blood pressure can have serious implications during pregnancy. This standard stresses the importance of early detection and management. It guides midwives on monitoring blood pressure, identifying risk factors, and implementing appropriate interventions, including lifestyle modifications and, when necessary, medication. Preparing for childbirth is a crucial aspect of antenatal care, and this standard focuses on equipping expectant mothers with the knowledge and skills they need for a positive birth experience. This includes education on labor stages, pain management options, relaxation techniques, and the role of support partners.
These standards provide a comprehensive framework for safe and effective childbirth assistance. They cover a wide range of topics, including monitoring labor progress, supporting the birthing person, facilitating normal birth, and recognizing and managing potential complications.
The first stage of labor is a critical period that requires attentive care. This standard outlines best practices for managing this stage, including monitoring contractions, fetal heart rate, and the mother's comfort. It also emphasizes the importance of emotional support, position changes, and pain management strategies. The second stage of labor involves the actual birth of the baby. This standard focuses on ensuring a safe and controlled delivery. It covers topics such as supporting the mother's pushing efforts, recognizing signs of fetal distress, and performing necessary interventions while prioritizing the well-being of both mother and baby.
The third stage of labor involves the delivery of the placenta. This standard highlights the importance of active management to prevent postpartum hemorrhage.
Fetal distress during labor requires prompt and skilled intervention. This standard addresses the management of such situations, including recognizing signs of distress, positioning the mother, and performing an episiotomy if necessary. The postpartum period after the baby is born is a crucial time for both mother and baby. These standards focus on providing comprehensive care during this time. We'll discuss monitoring maternal vital signs, promoting breastfeeding, providing emotional support, and addressing any complications that may arise.
This standard outlines the essential elements of newborn care immediately after birth. This includes drying and stimulating the baby, assessing their APGAR score, and initiating breastfeeding or other feeding methods as appropriate. It also covers important safety measures, such as preventing infection and ensuring proper umbilical cord care.
The first 2 hours after delivery are critical for both mother and baby. This standard emphasizes close observation and monitoring during this time. It covers topics such as assessing for postpartum hemorrhage, monitoring vital signs, and ensuring the establishment of breastfeeding or other feeding methods. This standard addresses the ongoing care provided to both mother and baby during the postpartum period, which typically lasts for 6 weeks. It covers topics such as promoting maternal recovery, supporting breastfeeding, monitoring infant growth and development, and providing education and resources to families as they adjust to their new roles.
These standards provide a framework for managing obstetric and neonatal emergencies, situations that require rapid assessment and intervention. We'll discuss recognizing the signs and symptoms of common emergencies such as postpartum hemorrhage, eclampsia, and neonatal respiratory distress, and the appropriate steps to take in these critical situations.
Bleeding during the third trimester of pregnancy can be alarming and requires prompt assessment. This standard guides midwives on identifying the causes of bleeding, assessing the severity, and implementing appropriate management strategies. It emphasizes the importance of collaboration with other healthcare professionals, such as obstetricians, to ensure the safety of both mother and baby.
Eclampsia is a serious complication of pregnancy characterized by seizures. This standard outlines the management of eclampsia and other hypertensive emergencies. It covers recognizing the warning signs, administering medications to control seizures and lower blood pressure, and providing supportive care to prevent further complications.
Prolonged or obstructed labor can have serious consequences for both mother and baby. This standard addresses the management of such situations, including identifying the underlying causes, augmenting labor if necessary, and recognizing when surgical intervention, such as a cesarean section, is warranted. It emphasizes the importance of timely decision-making and collaboration among healthcare providers. In certain situations, a vacuum extractor may be used to assist with delivery. This standard outlines the indications and contraindications for using a vacuum extractor, the proper technique for its use, and potential complications. It emphasizes the importance of informed consent, skilled use of the instrument, and monitoring for fetal well-being throughout the procedure.
A retained placenta occurs when the placenta does not deliver completely after childbirth. This standard guides midwives on recognizing the signs of a retained placenta, implementing manual removal techniques, and administering medications to promote uterine contractions. It emphasizes the importance of prompt action to prevent postpartum hemorrhage.
Primary postpartum hemorrhage is a significant cause of maternal morbidity and mortality. This standard outlines the steps for managing this emergency, including uterine massage, administering uterotonic medications, and identifying and addressing the underlying cause of bleeding. It emphasizes the importance of a coordinated team approach and timely intervention.
Secondary postpartum hemorrhage occurs after the first 24 hours following delivery. This standard guides midwives on recognizing the signs and symptoms, assessing for potential causes such as retained placental fragments or infection, and implementing appropriate management strategies, including medications, surgical interventions, and blood transfusions if necessary. It emphasizes the importance of close monitoring and follow-up care for women who experience postpartum hemorrhage.
Puerperal sepsis is a serious infection that can occur during the postpartum period. This standard outlines the management of puerperal sepsis, including prompt recognition of signs and symptoms, administration of broad-spectrum antibiotics, and supportive care. It emphasizes the importance of preventing infection through proper hygiene practices and early identification and treatment of any potential sources of infection.
Neonatal asphyxia, a condition where a newborn baby doesn't breathe properly at birth, requires immediate attention. This standard guides midwives on recognizing the signs of asphyxia, initiating resuscitation measures, and providing ongoing care. It emphasizes the importance of a skilled team approach, effective resuscitation techniques, and appropriate post-resuscitation care to minimize long-term complications.
And there you have it. A comprehensive look at the standard midwifery service standards. These standards, as you can see, are not just guidelines, but a roadmap to providing the highest quality care for mothers and babies. By adhering to these standards, we can help ensure safe pregnancies, positive birth experiences, and healthy starts for newborns. Remember, knowledge is power, and by continuously educating ourselves and striving for excellence in our practice, we can truly make a difference in the lives of the families we serve. Thank you for joining me on this journey through the world of midwifery standards. Don't forget to like, share this video with your colleagues, and subscribe to my channel for more informative content on women's health. Until next time, stay well.